Hi guys, on December 11th, FDA approved Pfizer's mRNA vaccine for prevention of COVID. It's a very exciting news. It's a vaccine which is given in 2 doses, 3 weeks apart, and is approved for people who are over 16 years old. And it's been shown by their studies, they studied at least over 40,000 people, that after the second dose of this vaccine, you get 95% protection. So very exciting news. I know there are people who are concerned about the vaccine because you know what happened? We kept talking about we're gonna get this vaccine, and now it's here. People are excited but concerned. One of the questions I get asked by my patient is, are you gonna take this vaccine? And to those people, yes, I did. I just received my first dose yesterday. So I'll be getting my second dose in 3 weeks. And so far, no side effects or no reactions. So just wanted to assure you guys. I also get a lot of questions by women who are either pregnant or trying for pregnancy or breastfeeding because they're concerned about this vaccine and pregnancy. So last week, ACOG, which is American College of OBGYN, and ASRM, which is the American Society of Reproductive Medicine, came out with their statements regarding this vaccine. And I thought I might give you guys some information to assure you. Now, ACOG says that if you are pregnant, there is no need to not to take this vaccine. Your doctor should not refrain from giving you this vaccine, because remember, this is a mRNA vaccine. It is not a live vaccine. There are no live particles in it which can cause problem in pregnancy. The only vaccines which are not given to a pregnant woman are live vaccine, and COVID-19 is not a live vaccine. So if you are a frontline worker, if you are at a high risk or you meet the criteria to get this vaccine, there is no reason not to take it. So please take the vaccine. It's not mandated. You can talk to your physician, talk to your OBGYN, and discuss the risk and benefits, and then decide whether you want to take this vaccine or not. Now remember a few things, that mRNA vaccine does not go inside the nucleus of our cell, which has DNAs. So that's why it is not gonna alter a cell DNA, and that's why it is not gonna cause any genetic problem. Again, it's not a live vaccine, and it is not going to cause any genetic problems in the baby. So it is very safe. Now, pregnancy itself is a risk factor. Women, it's been shown with the studies that women who are pregnant, and if they get COVID-19, they have increased risk of ICU admissions, as well as increased risk of ventilation support, especially if you have other risk factors like obesity, diabetes, then that will increase your risk. So your risk of getting problems because of COVID are way more than side effects or reaction because of the vaccine. Now, if you are planning for pregnancy, there is no need to stop planning or give it some time. You continue as your plan. So say, hey, you have received 1 dose of vaccine and you found out that you're pregnant now. That's okay. You can take your second dose of vaccine as planned in 3 weeks' time, because it is not a live vaccine, remember that. Now, if you are undergoing a fertility treatment, there is no need to stop those treatments or no need to change the pattern of your management. You can continue to get your treatment and continue to pursue your dreams. This vaccine is not going to stop any of that. If you are lactating, if you are breastfeeding, it is okay to take this vaccine again, because it is not been shown to go to the breast milk to the baby. So lactating mother, pregnant women who are trying for pregnancy should consider taking this vaccine. because again, it's not a live vaccine. I know I'm saying this again and again, but it is really important to remember that it is not a live vaccine. So because it's not, it is not been shown to cause any infertility. It has not shown to cause any first trimester or second trimester losses or any abnormalities in the baby. Now, side effects of the vaccine, some people worry about, especially fever, right? You can get some fever, and people worry about any genetic problems because of the high-grade fever. So the recent studies have shown that even if a pregnant woman had a fever, but if she's taking folic acid supplement, 400 micrograms a day, neural tube defects have not been seen. And 400 microgram of folic acid is in your prenatal. So if you are taking prenatal, don't worry about it. If you get some fever because of the side effect of the vaccine, then just take acetaminophen, Tylenol, something like that to decrease your fever. The other side effects or the reaction to the vaccine has been shown, like injection site pain, little bit of irritation, flu-like symptoms, but they are very mild. There have been couple cases of severe reaction, literally couple only, in Great Britain. But those people who had the severe reaction were prone to anaphylaxis and used to carry an EpiPen with them. So if you have a severe allergy or severe anaphylaxis in the past, then you might have to consider this again, talk to your physician, and decide whether you should or should not take this vaccine. Couple cases of Bell's palsy have been reported, but again, when the study was done, we don't know. Bell's palsy is pretty common and it can happen with or without vaccine. So we don't know if these cases happen because of the vaccine or were there any other underlying causes for it. So the side effects and the reactions have been seen in only 0.65% of people who got the vaccine, as compared to 0.5% people who got placebo. So it's very similar, very low side effect or reaction. But the efficiency in preventing the COVID is 95%. So please talk to your physician, please discuss the risk and benefits, and consider taking this vaccine. Thank you.